Hi everyone. Good morning. I wanted to do a video because I wanted to share some of the experiences that we had yesterday. I felt that it's really important to share this experience because I know, well, first of all, it's happened to us several times, and I know it will continue happening, unfortunately. And I know firsthand several families who have gone through this, and some of them I've would actually know personally. Um, as many of you know, my son is 17. My son Justin is 17. My son is on the severe side of the autism spectrum. He is considered nonverbal. He does have some speech, but he has very little language. Now, before you come at me, because if this is shared and it is seen by other families of children with autism or even adults with autism, um, I've gotten a lot of hate before, and so has some of some members of several groups that I'm in for referring to a specific child as having severe or non-severe or high functioning or low functioning autism. Um, that is my opinion. That is the opinion of the people who have worked with my son. It would be no different if my son would be diagnosed today. My son would be diagnosed as a level 3. That would be the level of autism that's going to require the most care um, for his entire life. Um, Back when my son was diagnosed, he was diagnosed with autism spectrum disorder as well as ADHD and um, intellectual disability. And that was at age 3. Prior to that, he was diagnosed with just severe global developmental delay. Um, so I know that many people don't want to use labels, but given the situation, unfortunately, I don't have a choice. I feel like not many people know what level 3 autism looks like. So, um, and at the end of the day, I mean, we may not want labels, and I get that, but when your child is diagnosed, if your child would be to be diagnosed right now, your child will be given a level, whether it's 1, 2, or 3. So 3 is definitely the level that my son would be at if he were to be diagnosed today. So that said, and taken out of the way, um, my son, we yesterday we were at family's house. We usually only go to two people's homes, and that is like maybe a couple times a year. We really don't get out much, usually because of these type of situations. Um, we were at family's house. My son was starting to get rowdy. He was getting very, he was jumping around, and he ran up at a table and knocked over a large bottle of glass vodka. The pieces went up in the air, glass was shattered everywhere, and a piece of glass went into my son's foot. At that time, the entire family did what family does. Everybody was amazing. Everybody was understanding. Everybody went to work. They picked up the glass. There was people covered in blood helping us. Like it, it is what you would expect from family. And so I'm grateful for that. But so of course we had to pick up and head over to a medical facility so that my son can get stitches. Um, I gave them a heads up. I called a medical facility that is targeted for children. In fact, they actually even have a building and a foundation that is designed for children with autism. So I go to this facility, and they pretty much told me right off the bat that they could not take the risk of even trying to see him or even stitch him up because they did not have the manpower or the training or anything like that to be able to do that. So they did try to clean him up. They walked him through it. Um, I, I wasn't really so upset with them. I understood. We left. We went to another facility. Now that facility didn't even bother to even try. They did not look at him. They basically told me right off the bat that they could not help him, that it would be a risk. Um, it's funny because so many brave, healthcare workers put their life at risk um, with working with patients with COVID, but you have a child with autism that's bleeding and they can't take the risk of being kicked. So I was told right off the bat that they cannot help, that there was really nothing that they can do for my son, that I needed to go somewhere else that had the capabilities. So I went to another facility, and luckily that facility was a little more welcoming, and they did what they had to do. It wasn't easy, but they did it. They were pretty good and caring. Within 2 hours, we were out of there. We chose to go with glue and not stitches, just in case he tries to pull the stitches. And I was told that he would heal in a couple days, and we were out of there. But this is my thing. This is my where I'm upset, and I'm not necessarily upset with the individuals that told me they couldn't care for my son, even though I find it a little disturbing that that even took place. I'm not so upset with them. They can only do what they can do with the tools that they're given. My situation is, and the reason why I'm upset over it, well, mainly it's because I see it all the time. And it it actually proved what I kind of already knew was going to happen. And I cannot tell you enough how many, not just my family, but how many families I know with children very similar to mine that are terrified to take their child to an emergency room, even when their child needs medical care, because they risk not being seen or not being cared for. And they're actually also risking that if their child, they're going to be, the child is going to be scared. So you're risking your child being taken and being Baker acted, which does no one any good. Now, I'm not saying that sometimes people don't need to be Baker acted, but in our situation, my son was not really misbehaving, but he is a difficult case. So, a long time ago, we took one of the behaviors that my son engages in is headbanging. It is very, very common in children with autism, especially, like I said, on the more severe side. My son had his eyes all black, and the headbanging was really beginning to be a problem. It was one of his self-injurious behaviors. So we had to take him to the emergency room because we were concerned that there was any kind of damage, or we needed to make sure that there wasn't a reason for the headbanging. I feel like every behavior has a function. And even though one behavior had several functions, we needed to make sure that there wasn't anything medically going on. The minute we walked in, we talked to the doctor, we told the doctor what was going on, and the doctor threatened us to have him Baker acted because he was being a danger to himself, obviously. And basically, we walked out. We walked out and we worked with our behavior therapist, and we did some testing that was sent by our doctors and by our neurologists on an outpatient basis. And although he does do the headbanging sometimes, we were able to handle that situation. But I can't tell you enough how many people are terrified because of the kind of care that our children receive when they go to the emergency room or to any kind of medical facility. This is not right. You know, our kids are people. And, and another thing that really like stuck a chord with me, like this particular doctor that saw him, that wouldn't even see him, told me, well, he's a 17-year-old. If one of us gets kicked, if he would have been 5. And I'm like, oh yeah. So it's typical, and I see it all the time, and it's just very sad, and it has to stop. So I want to remind everybody that children with autism will be adults with autism, and there's a lot more. And I'm grateful for those who want to spread autism awareness, and that's great. But if you really want to spread autism awareness, share this video with other people, because there's a lot more to autism awareness than just putting in a light bulb in your house. And there's a lot more to autism awareness than just putting it on your timeline on Facebook and saying that you want to spread autism awareness. That's great, don't get me wrong, but we need to educate. We need to educate medical staff. Our children are going to be adults, and both adults and children with autism or with any special needs are people. And if you want to convince people that that other races matter and that other genders matter and all that other stuff that's so prevalent today, then we need to also spread that autism lives matter. Like, I don't understand why our kids are getting crappy care. They're people. I was talking to a mom a few months ago through social media who was concerned that their child had a pain somewhere. And she said to the doctor, yeah, doctor, but is there anything that he can take for pain? Because what if he has pain? I don't want to do this because then what if he has pain? And I don't remember exactly what the situation was, but the doctor looked her dead in the eye and said, well, does it really matter? First of all, if this is the way that you feel and you are a medical professional, please find another job, because yes, it matters. He's a person. Like, how is that okay? I just don't get it. Um, so I can't tell you, like, I can't tell you how many of us are in this situation. This has to stop. We need to be more aware. Um, you know, when you call 911 because you have an emergency, the cop doesn't ask you on the other end, well, wait, there's violence? Yeah, I kind of don't want to go into that situation. I don't want to risk my life. No, you go into the situation and you are risking your life. So, as a medical professional, you have to do the same. You can't just, be like, yeah, no, I don't want to treat that child because, I might get kicked. That's not okay, guys. And we need to do better. Thank you for listening.